If you or someone in your life has been diagnosed with ALS and use a power wheelchair, you may have already heard terms like pressure relief or turning schedule. Today we will discuss what is meant by pressure relief and why it's so important for individuals living with ALS and their caregivers. ALS is a disease of motor neurons which affects a person's ability to use their arms and legs. ALS does not affect a person's sense of touch or pain, so turning schedules or pressure relief can help decrease a person's discomfort and protect their skin if they cannot easily move. If someone is unable to move themselves in bed or uses a power wheelchair to get around, they are at risk for pain, swelling, and bed sores. Pressure relief maneuvers are designed to prevent complications like bed sores from occurring. We will demonstrate these maneuvers for someone with ALS using a power wheelchair, as well as an in-bed turning schedule for nighttime pressure relief. It is common for people with ALS who use power wheelchairs to spend a lot of time in them. In fact, spending up to 10 hours or more per day in a power wheelchair is very common. Pressure relief uses a combination of wheelchair features to reduce pressure on your body and improve blood circulation to keep healthy skin and free of swelling. Pressure relief should be done for 1 minute for every 30 minutes spent in the wheelchair. In power wheelchairs, pressure relief maneuvers are typically performed by individuals with ALS or their caregivers using an attendant control panel. While every person with ALS has unique needs, there are 3 must-have power wheelchair features for people living with ALS. These are tilt in space, recline, and power elevating leg rest. Though there are different formulas to determine exactly how much tilt and recline are needed, the goal is moving as much as possible and trying to perform some form of pressure relief every 30 minutes. For adequate pressure relief, all 3 features should be combined. For pressure relief, you will need tilt at 25 to 45 degrees, recline at 110 to 150 degrees, combined with elevating leg rest for at least 1 minute. The first step of pressure relief is tilt. A minimum of 25 degrees is needed for proper pressure relief. Recline is the next step. Always tilt before you recline. The range should be between 110 and 150 degrees. The last step is to elevate the legs. The greater the angle, the more effective it will be at relieving pressure. You should feel the weight of your body transfer from your hips to your back. Stay in this position for at least 1 minute every 30 minutes while you're in your chair. When you return to your original position, recline forward, tilt, and then last your legs. This will prevent you from sliding out of your chair. Turning schedules should be completed with the help of a caregiver so that a person with ALS who cannot move themselves in bed changes their positions every 2 hours. Often, nighttime care assistance is required to help them turn when sleeping.
To avoid shear force or excess pressure, a draw sheet method can be used. Pillows can be used to support a person's arms, legs, and back when lying on one side. For best results, the head of the bed should not be elevated past 30 degrees, and the person should not be propped up because this may put pressure on their lower back and hips. During pressure relief, it is important for the caregiver to be aware of areas that are prominent at the pressure source. This includes the back of the head, elbows, spine, lower back, hips, in between the knees, and the heels of the foot.
Bed sores can be very painful, but a person with ALS might not feel early warning signs like redness or irritation until it is too late. It is important that caregivers monitor these areas by looking for early signs of skin redness or irritation that may lead to ulcers. Caregivers can help support tender areas with pillows. Thank you for watching. This video was made by future occupational therapists. We hope this video was helpful in explaining pressure relief procedures for people living with ALS and their caregivers.